So I'm going to talk a little bit about today about chiropractic and products. My background is I've been in chiropractic for over 30 years. I've been in Wausau for most of those 30 years. About 25 years ago, I was part of the starting of a company called Allied Health. I was CEO for 20 years, and in that time, one of the things we did was bring products into the clinics and that. So at our peak, we had 58 clinics in the Midwest, and we learned really quickly believing in a product, telling people the product, but having it sold in a product was totally different. And if you did not have systems, if you don't have a system between what we call the back office and front office, so the front office is where the patient checks in, the back office is where we give the treatment. But if there's miscommunication, nothing sells. And again, no matter how much we all say we want to sell something, so what we made sure is if the back office, we use the doctors, what we called is his authority or social authority. So social authority we want to use from the doctor. He's not the seller, but if he tells somebody that they need a back brace, or tells somebody they need nutrition, or tells somebody they need a foot support, that then goes to the front desk and they do the selling. So we try to minimize the time, less than 15 seconds in the back office. So I'm going to talk about that back office real quick. I want to make sure that I'm supporting that patient every way possible. We know that the behavior that causes a patient to be sick is long before the symptoms show up. And if we as chiropractors don't step and fill in that gap, so if somebody has indigestion and we adjust them, but we don't help them with their indigestion, or if they have low back instability and we know they're going to go out and rake leaves, but we do not give them any tools to change the outcome, it makes no sense whatsoever. So I'm going to talk a little bit about just a product, and you can use it in any product, but we're going to talk about Bax-Max. So one of the things that Dave from Bax-Max, something you think I've been at 30 years, I would think of something like this, is do you ever ask your patients what they're going to be due for the weekend or what they're going to do for the next week? And if they're going to do something, do you use that moment to educate them? So I have a patient that says, yeah, I have to mow my lawn this weekend. I have a chance then to talk about how to ride in the lawnmower, but also if they aggravate themselves on the lawnmower, then I can talk about a product like Bax-Max and say, this is a product that's great. It's easy to put on. You can tighten it and untighten it, and it adds stability because when I showed you that x-ray and you have a really degenerated disc. So remember that space is smaller. Well, that means you've lost your cushion. So when you're pounding on that lawnmower, the reason that you get off it and you feel so sore the next day is it swells up. You've lost your shock absorber. So if I use something like a back belt, I can put some pressure on it, it tractions you out, it allows us to dampen that compression, and it's so easy to put in. I can loosen it up and tighten it, loosen it up and tighten it.